All right, everyone, welcome back to another webinar presented by the VATA Young Professionals Committee. Today I have with us Dr. Elizabeth Neal. She currently serves as the Clinical Education Coordinator and Assistant Professor of Instruction in the Department of Health and Rehabilitative Sciences at Temple University in Philadelphia, Pennsylvania. Prior to coming to Temple, Dr. Neal served in the same position at Xavier University in Cincinnati, Ohio. She completed her PhD in Curriculum and Instruction with a concentration in Athletic Training Education at Indiana State University in Terre Haute, Indiana. She additionally completed her post-professional master's in athletic training at ISU. Born and raised in Erie, Pennsylvania, Dr. Neal stayed local to complete a Bachelor of Science in Athletic Training with an Exercise Science minor from Mercyhurst University. Dr. Beth Neal has also worked clinically as an athletic trainer with Union Health Center for Sports Medicine in Terre Haute, Indiana, as well as Hardin-Simmons University in Abilene, Texas. She has received the Ethos Award for Excellence in Teaching, Scholarship, and Service at Indiana State University, and the Z. Mel Bleckenstaff Memorial Doctoral Student Scholarship from the National Athletic Trainers Association. Dr. Neal has served as the secretary for the Indiana Athletic Trainers Association and on the Indiana YPC. She has spoken and presented research at the state, district, and national level. Her research interests include medical documentation and healthcare administration, clinical education, and educational advancement specifically focused on mental health initiatives. Thank you so much for joining us.
Absolutely. Thank you for having me today. I'm excited to chat with y'all.
All right. So as we know, social media is a huge part of all of our lives, both as clinicians and, in our everyday lives. Where do you think social media has its place within the athletic training realm, and how can we utilize it to our advantage while still, protecting our patients?
Yeah, so I'm a huge proponent of social media, whether it's through my personal life or through even a professional stance. And so some of the biggest things that I think of, kind of like to framework this, is making sure that you're representing yourself as well as the profession in a good manner, in a manner that you want to portray. And additionally, making sure whatever you post is HIPAA, but more importantly, high-tech compliant. So oftentimes we'll hear like, hey, don't post that, that's a HIPAA violation. We're actually, in 2009, we do see kind of an add-on, for better words, to HIPAA, where we can do extra protection for patients from an electronic form. So that includes all the social media postings. And so I love having this conversation with especially young professionals and students, because they're like, I just want to showcase everything I do. But we really have to talk about and, discuss means that are safer and that protect you and the patient. So those are kind of the big frameworks of things that I notice specifically on my end of things.
Okay. So you mentioned obviously things being HIPAA compliant as well as high-tech compliant. Can you touch base a little bit more on that?
Yeah, so when we look at it, when you go to post, think about the same rules as HIPAA compliance. So you should not be able to locate somebody based off of a school name, jersey number, name of the school, faces, identifying markers such as tattoos or scars or things like that. Because it's going to be important that we're not showcasing people's health out on the internet for all to see. One of the things that I think we often see where people try to get that layer of protection is, posted by permission from the patient. And for myself personally, this is something that's a little bit conflicting, because yeah, I'm sure that you asked that patient, may I post this on social media? And that patient's probably like, yeah, I would love for my injury to go viral and have that moment and claim to fame. But I think we need to look at it from two aspects. One, if the patient's a minor, we always think of consent, but that consent has to come from that legal parent or guardian. And you must get assent then from the patient themselves if they're a minor. And so I often am kind of judging by saying this, but I see those posts of young people and think, hey, was there consent and assent that happened? And also, preferably, did it happen in a signed manner? If I have even someone come just for pictures for marketing for, the various universities I've worked at, you all have to fill out like actor and, these privacy forms stating, hey, whatever you took can be delivered. And so I think that if there's ever going to be a point where you are posting potentially identifiable markers, working that with your legal team and having that extra step of protection is going to be really important. I think the other way that people kind of get themselves caught up is you may block out that patient's face by putting an emoji over their face, but they have like a jersey on, and you can go search the roster at, North High School and see who number 17 on the football team is and actually be able to then see the injury from there. So I think that there's a lot of layers that you may feel restricted. But I think the biggest thing is just, again, making sure that we're protecting that patient's privacy, and what we do is going to be very important.
Gotcha. And that makes sense. Would you say that you would use similar restrictions, say if you were in a Facebook group and have a unique injury and you want to ask about it and get some insight from other clinicians?
Absolutely. I think there are means to de-identify and ask. So let's kind of set up a scenario like, if I said that I am an athletic trainer working in the Division I collegiate setting, and I'm working with a patient who is suffering from a unique ACL recovery, and just wanting advice on some extra, maybe like mental health tips to be able to, push that or help encourage that patient along in their recovery. I think that kind of generic statement is fantastic, and that is an appropriate means. But I think that there's that line of, again, a picture that you can see like on the x-ray where there's, the person's name or identifying number or something like that. That's that line again of where I see these posts and I cringe, because as private and as secure as we think even a private Facebook group can be, there are easy ways. If I take a screenshot of something, nobody has any idea that I just screenshotted something that's supposed to be private. And again, I know that that's violating a lot of the rules of these different communities. But that's not to say that what I'm putting out there, I'm trusting a couple thousand people to all be obeying the rules for the patient I'm working with's privacy, as well as my own job and CYA to myself. And so I do think there is a place for that big open communication. But I do think that, if you take a step back and say, hey, would my legal team be okay seeing this on social media? And I know that seems dramatic, but that's the approach that I challenge all my students and colleagues to take every time they go to post something on social media.
Yeah, and it just makes you think, you mentioned students might have their jersey numbers on, or if they're in workouts, they may just have a shirt that says the university or college on there. Mm-hmm. And it makes it very easy to pinpoint, where those things occur. And also just safety from, you don't know everyone's mental state, that could put everyone in a bad spot.
And I do think that most of the posts happen with good intentions. I see my students all the time. They're so excited for, that first on-field evaluation picture that somebody got of them. And that's a pride moment. And they want to showcase how proud they are of athletic training, of how excited they are of where, their many years of education has gotten them, and that they were able to help in that process. But it's just that line of, again, of, patient protection and patient safety. I do want to make sure I note though, if, that example of on field, if the local team newspaper is there and happens to take a picture of it and talks about it, that in and of itself is not a violation. The second that you as the healthcare provider intervene or give information to that conversation, that's when the violation has occurred. So, seeing the local, Sports 10 newscast at night with someone on it isn't necessarily a violation. That's their job, and they have no medical training. So it's important to kind of keep those differentiations in your mind too, as you're seeing some of the posts out there.
Absolutely. So moving forward, as you're dealing with and helping, obviously you're in the educational setting, what, obviously the things you had mentioned, is there anything else that you would mention to either your students or young professionals in terms of using your social media just as a clinician in a safe manner?
Yeah, so I actually think the use of social media has a widespread ability to positively change and help athletic training. From a recruitment standpoint, we're seeing that by broadcasting again in a safe manner what our students are doing out in clinicals and in the classroom, that's a means to recruit young students into the profession. And so I think it's awesome for people to get to be able to see that piece. I absolutely love seeing the advocacy on social media and the widespread good, especially with, you know, the COVID-19 pandemic. We've seen a lot of potential changes to how athletic trainers have functioned over the past year. And I think this is the awesome, coming from a college of public health, this is the awesome time to say that athletic trainers are part of public health and we have a role and we have a long-term future as a profession. And although there are going to be changes, I think even in the long term of some of how we function, there's still a large and huge job market for athletic trainers. And I don't even think we've tapped the potential yet of where to go. And so I love seeing the, you know, the various aspects of advocacy for athletic training. And again, that's showcasing. I also really like the potential of the interprofessional education that can occur because athletic trainers can, it's very easy for me to follow other healthcare providers. And actually, as both an educator and a clinician, I've taken awesome tips from, you know, sideline evaluations or rehabilitation techniques. And I'm like, hey, I found this on TikTok or I found this on, you know, Instagram. And having some of those pieces are like, they're means I never would have come across otherwise. I think one of the other cool things that I really found exciting over, especially the past few months, is this new network of athletic trainers, and not just clumps, but like widespread. There are people that I have talked to at conferences that I never truly met in person, but we've interacted on social media for various reasons. And it's been a really cool time. I just had an opportunity the other day to actually meet somebody I had been talking to on Twitter. And I was like, it's an awesome opportunity that never would have happened had social media not been there. And so, again, that's why I think it's very important that you know, not that we identify athletic training that it's all rainbows and butterflies, but that we be cautious of how we represent ourselves because others are watching us and watching our behaviors. I think one of the things that kind of is, I don't know, one of my sticking points is we so often hear, well, people don't know what athletic trainers do. People don't know what athletic trainers do. But then we're broadcasting ourselves by taping. We're broadcasting ourselves by, you know, saying that we're, you know, hydration specialists or things like that, where we're not truly tapping into the potential of what athletic training is. And so people looking in are like, oh yeah, those are the people that tape people on the sidelines or squirt water into people's mouths on the, you know, on the sidelines. And so, again, by making sure that we're safely showing the depth and breadth of athletic training, like we have the opportunity to reach some of those other healthcare professionals and lay people and say, hey, this is what we do and this is what we can do.
Absolutely. I know, like one of my niches is I work with equestrian, and when I first started, I had no contacts within this world, and it started off with the same thing. I met in what I think might have been in the women in AT group, a woman who mentioned something about equestrian. I'm like, I work with equestrian, and we talked for a good solid year on various platforms, and finally got to meet at NATA a few years ago, and the two of us got together and we actually created a Facebook group for just that population. And it's not very big. It's got about 70 people in it, but to be able to go to people who work within that niche to pick each other's brains with, or, you know, share research or things like that, I think is, you know, for us is a great thing. But I agree with you. I think it's so important that we show the different components of the things we can do. Like, again, I know some of the things I post are a lot of like, here's the research I did, or here's the situation that, you know, here's the cool event that I got to work and how, you know, it was different than my typical setting. So I think it's up to us, in my opinion, I think it's up to us when it's like, well, no one knows what we do. It's like, well, we're the ones who have to tell them, because you can't expect everyone to just drop what they're doing to research what we do.
And I think, you brought up a good point of kind of that private versus public scene where, if you're in like a Facebook group per se, that's going to be a lot more like you have to be invited in or join in. And, that's an awesome place where like you can share those resources or, have some of those conversations that we need to chat about, and like you need to have some more input and things like that. I saw so much, especially during the COVID pandemic, of, hey, what resources are you using? Like, oh, you wrote this policy, can we adapt this to our place? And so why reinvent the wheel every time? Like I think we so often, and we see this in education a lot, well, I need to make my program this program and I can't share things with other people. I know who we're going to recruit at Temple and who typically is going to be the student. And being so far on the East Coast, yeah, of course, there's going to be that natural competition of people in the region that we want to make sure that we're all doing different things and bringing in, making our program identifiable. And yeah, on a national level, we want to make our program identifiable. But working together on an assignment with somebody that you found through social media or saying like, hey, I did this really cool thing is awesome. I actually worked with an educator last year. She posted something about a project she was working on. I was like, I'm doing something really similar. Like, can we, chat and share notes of what we did and see how it worked? And it was an awesome exchange. And again, it was all based on social media and what I had, seen posts of for. So I think it's really important, again, to keep that up. I do think that there is a line, though, kind of on the flip side. If you're going to have a social media account that is linked to something professional, one, make sure you're knowing that what you like is linked to that account, especially I'm thinking Twitter. So making sure, again, I'm not stifling who you are or what you are, but just know that conscious decision that everything is all attached to that, and what is on the web is on there for years to come, even when we think we've deleted it. So, just being mindful. And the other thing is, if you're gonna have an account, keep it active, because that's really what people are looking for. And there is a lot of questions when there's old accounts that aren't kept up to date as far as credibility and other things like that. So just be mindful that if this is something you're going to do, do it. I am not in charge of social media anymore at the current location I'm at Temple, because my program director already was in charge of that. But last year I was at the school I was at, and one of the things I needed to be conscientious about was actually carving off time in my day and the week to like, hey, this is what I'm going to post for the week. This is where I have things. This is how I'm going to do it. And being deliberate in what I was doing and not just kind of random, specifically coming from a group account. And so I know the program director I work with closely here, she has time scheduled. I believe it's every Monday morning. And she'll go in, we use like the where you can, type them in and have them ready to just send out throughout the week. And she'll just spend time and work on her social media plan. So again, it can be that organic conversation, but I think also from professional sides, whether you have one at your university, the high school program you work at, just kind of keeping that intentionality in mind is going to be really important.
How often do you think people should be posting to keep those accounts active?
So this is a really, I feel like back in back in the day it was, well, you can't post more than once a day because that's going to be weird. But I think, posting 5 to 7 times a week is a lot for people to keep up. I recommend every couple days if possible. And again, there's opportunities with things such as like Hootsuite, I believe is what it's called, or some other automatic like send out things that they're free if you only use one platform. And so you can go in and you can pre-plan all of your, sit down on an afternoon and pre-plan like a couple of weeks of material out and have that ready to go if you want to keep more of a formalized thing going. But again, enough that it's going to draw in the likes and it's going to draw in the people to follow and have that that presence on social media. It does take time, so.
Yeah, for sure. I know, like, we have an account for my clinic, and I think we've had it almost 5 years, and we just hit 500. Like, it's a very slow thing to grow when you have only a certain population that you're potentially reaching out to.
Yeah. Yeah.
Uh,
It's also very, like, how are you tailoring yours? And, this is more of a rhetorical, but like,
mhm.
if it's more directly based to the patients you provide care to, or the niche around you, yeah, it might be smaller, but that doesn't necessarily mean it's not productive and helpful and serves the purpose that you have it there for.
Yeah, absolutely. I know one thing that we've found really helpful, because students over summer, we all know they don't like to check their email. And that's when pre-participation paperwork gets sent out and things like that. So one thing we did, especially during the pandemic, was we utilized more of like Instagram Live and Reels and things when those came out, to be like, we did one on like, okay, here's how you take off gloves, because that's something that people don't tend to think about if they're not in our world. So like we did one, we've all done this. You take a little Sharpie, put it on your gloves, and how to take them off. We've done that. Going through paperwork, reminders, there are websites where you can adjust memes to be your own. So I, had way too much fun over quarantine making a bunch of memes about paperwork, but
why not though? Like, it's the mundane tasks of things you have to do. So why not add that layer in? And now too, you also have those resources ready that you can just repost that a year later and say, hey, look at this. If nothing changed, like taking off gloves is not going to change. So just, repost that. Next year rolls along for all the new patients coming in. Hey, here's how to do the paperwork in our system. And I think it actually could have that efficiency side too. And again, you're right. Like, emails are a thing of the past. They're definitely purposeful because of, all the legal aspects of things, and having that documented communication. But again, if it's not some task that I need, like potentially school to look back and say, yeah, this happened and it's in a formal location, I'll utilize various aspects of social media in an appropriate way to communicate with, students or, patients or whatever, again, as long as it's done in that correct manner, because those are things that they're on all the time. And, I think for a while, I felt like social media got really big. I'm going to age myself here at like the end of high school, beginning of college for me,
yep.
as things like really took off. And it felt like there was that line of like, well, this is the young people and this is the old people. And now like, I'm really enjoying seeing this overall, like, age is not a factor anymore on a lot of platforms that we see. And, having that crossover happen, I think is going to be a really cool time to have that, potential mentorship opportunities too.
Absolutely. I know I'm going to age myself too, because I'm right there with you. I've seen on TikTok, a couple of athletic training accounts, and it's, it's fun to see how they interpret it, especially, the ones that I follow. I seem to find only the high school ones, but, the things that they post are like, it kind of just shows us across the board. And there are jokes that like no one besides us is going to get, but you know what? Sometimes that's okay. Or they'll do, follow along with me as I set up for JV basketball or something. And again, in a minute long video, they show so many things that we do that aren't just taping ankles and filling up water bottles.
Yeah.
But I completely agree with you. I think it all depends on just how you use it. If you use it, obviously, like anything else, if you use it in a negative way where you're bashing or just complaining, no one's really going to want to hear you out anyway.
Right.
And I tell people all the time, like, there are times where it's like, yeah, my kids drive me crazy, but I also wouldn't trade them for the world because I couldn't imagine being anything. And it's okay to, have those moments, but you kind of also have to be like, yeah, today was hard, but this is what made it easier, or this is what made it better, or whatever the case may be. But that was, I know with the pandemic, that was a way that I was able to connect with my athletes, because we were on spring break when we had to send the whole school home.
Yeah.
So being able to still connect with them over social media when it's like, I can't see you because they were on spring break. So I had athletes who left in March and I didn't see until August or graduating seniors who I didn't see until, 2 or 3 weeks ago, which is strange, but I felt like social media kind of gave us a way to still connect with them, see how they were doing, check in on them, because a lot of times our athletes will post so many things on social media that they don't necessarily tell us, but they may be posting about how difficult, obviously, quarantine was, to be able to reach out to them and be like, I'm still here if you need me, whatever, keep those connections.
Yeah, no, I think it's really important to also note too that although like social media is amazing and I like it, there are some days that I just need to not necessarily go on it, or that I need to only associate with certain accounts that maybe, I don't want to say like only are positive, but there's times that like I notice myself, like, I need to gravitate toward that, or like, hey, I'm going to get frustrated if I comment on this. So taking that, I use the 24-hour rule for emails sometimes. And I use that notion in posting too, of like, if I post this, like, is it going to have a negative response? Am I going to like the same post 24 hours later? And so, taking that opportunity, taking a step back, I have not done like a full social media fast where I've like deleted all my accounts off my phone or done anything like that. But I've definitely had times that I'm like, I need to take a step back and either be present in the moment of where I'm at and what's around me, or like, hey, this is a lot of, negativity going on right now, or just things I don't want to be associated with, and making sure that I have that time to, keep my cup full, to then fill into, to be able to assist and help other people in that time too.
I completely agree. I try, not so successfully, but when you first wake up, not scrolling and seeing what comes up. I didn't mean to go through a fast, but it happened. Back at the beginning of 2020, somehow Instagram deleted my personal account. I had an old account on there that wasn't in use, so I tried to delete that and accidentally deleted my personal account, which was traumatic because I lost, years worth of memories and pictures, that included like my gap year, grad school, doctoral school, my moving around, my first solo trip with a team, like all of those, posts were gone and I had to start from scratch. However, I also found the positive of there were accounts on there that I was so afraid to unfollow because it was maybe people from college or high school who I was like, they would get so mad at me if I didn't do that. And as I've started that new account over the last year, it's like, well, I had over 800 people who followed me or I followed. It's like, I can't remember every account.
Yeah.
But it kind of gave me a fresh slate of, if I don't want to, and that, there are people who I'm like, obviously they don't care that much about me. They haven't followed me either. So
right.
It's one of those things where follow accounts that either, my general rule is like, if it doesn't, I feel it's very Marie Kondo. It's like, if it doesn't bring you joy, positivity, or insight, or like challenge your way of thinking, it's not worth the energy. If I am scrolling and I see this, because there were accounts, like if I scroll and I see this person, it physically made me, it made my stomach churn or, made me upset. It's like, that's not, why am I following them? Because I happen to have gone to college with them? No, that's not a reason. Yeah. So I think it's important that we, in our personal lives, set that standard of, it's okay to not follow somebody or unfollow them if they're not adding to that. And it doesn't have to be, rainbows and smiles, but it has to, as long as I shouldn't see this person's account and physically just feel myself tighten and get angry just by seeing a picture that may not even have them in it, just have their handle. And I think that that's important for us, because we all know athletic training is stressful no matter what environment you're in, whether you're in the educational setting, the collegiate setting, high school, hospital, whatever setting you're in, there is a great amount of stress that goes into it. Social media, I feel, shouldn't add to that stress. It does, but it shouldn't add this excess level of stress.
Yeah. I definitely, I've seen many. I worked in a high school for a little bit, and it helped being in social media that I understood and appreciated it. But I had patients who were like, well, I saw so and so was with so and all of that. And I almost think too that that could easily translate to the adult life if you're not, being careful and again, being mindful of it. But one of the things I want to make sure that I mentioned too is that, having that line between a personal and a professional account is very important, and to know what your intention is. So like for myself, again, I'm going to use my Twitter for an example. I don't have two separate Twitters of a professional me and a personal me. And again, I don't run directly right now any of our accounts from like my phone or anything like that. So what I have chosen for myself to do is that I basically only tweet about professional things, or it's things that I believe are very important to me, like, whether it's things that I agree and or want to be associated with and be a part of. But again, I know that in my bio, I have where I work. And although it's not truly a work account, that is means in and of itself to link me to my employer. And I think it's important, with this, like we'll say like, oh, it's just my private account. I can do what I want. And if it's something you truly want to stand for and that's going to cost you your job, then that's a decision you have to make, whether that's for what other people deem good or bad.
Mm-hmm.
But it's very important to know that people have been fired from their positions, even from like HIPAA compliant posts that just did not represent what the employer had in their contract. And like I don't want to list any specifically here, but if you do a search, you can easily find a listing of people who are fired for their posts, and you may say like, oh, like these were fine, and that's fair. But again, if you're making that link to your employer in your bio, you are an extension of that employer, whether you put the clause in there, views are my own or whatever, it still is going to have that link back. So again, just being purposeful what you do, and knowing that what you post is out there forever, some way, somehow.
Yep. And again, I know like my athletes are all like, oh, well, on Instagram, I have my real account, I have my Finsta. And it's like, I have found my athletes' Finstas. Because again, if you follow someone, it easily tells you all the time, like, oh, people you might like, or, people you might be connected with. It's like, just because it's a fake account doesn't mean that the reactions aren't real. Yep. We've heard it time and time again that student athletes have lost scholarships and been denied to the universities of their choice or whatever because of what they post. Because again, if it links to that college or that place and it doesn't fit the memo, it doesn't fit their views, they're not going to want you. Mm-hmm. And they're not afraid to tell you to deny that, because someone else is coming right up who will take your spot.
Yep.
So, and that's something that's like kind of I feel it's like it's a practice what you preach kind of a thing. If we may say, okay, don't be posting things that are going to come back to haunt you. I love the 24-hour rule. I think that is such an easy way to also de-escalate a situation. If you're like, I'm like fuming mad and I want to post this, in 24 hours, am I going to feel the same way? Am I going to get negative backlash? Is it something that 24 hours, 24 days, 24 months down the road, am I still going to stand by what I posted?
And I mean, we have to continue to think about that notion of social media is typically through some sort of written text. I know there's pictures, I know there's GIFs all over, but like the notion that how I say something can completely be misconstrued is very real. It's just like text messaging or anything like that. And so knowing that, how you say something, especially if these are people you don't truly know, really has the potential to, may not be taken the way you meant, and then could turn into something else. So again, just, making sure that, again, it's not all rainbows and butterflies, and I believe that conflict can happen, but that it's done in an appropriate manner is going to be so important for especially how you portray yourself on social media.
Absolutely. And it's one of those, if you get into a conversation with somebody on, say, Facebook, for example, it's okay to have different points of view on a topic as long as you go about it in respectful ways. And I've seen people who go down rabbit holes where I'm like, I hope your employer doesn't see how you escalated this situation. And I've seen people literally say, you know, something along the lines of this, you know, this conversation is no longer serving its purpose and I'm going to bow out of this conversation.
Yep.
And again, if someone were to find that, being like, we were having a conversation and then it turned ugly. And before I said anything inappropriate, you know, I was like, okay, I'm done. It's very similar to how you talk to toddlers, being like, you know, I'll continue this conversation with you when you've calmed down.
Yep. Yeah. So. Yeah. No, it's a gray area. But to me, it's a positive gray area. It's something I'll continue to use. I'll continue to stand for what I believe for, advocate for athletic trainers, demonstrate what we can do, and also, you know, form those relationships, and both to people I may not have known and those directly around me. And whether we like it or not, social media is here to stay. The platforms are going to continue to adopt and adapt as time continues to move on. But you know, again, making sure that you have a goal and a plan for what you have and what you do and how you expend yourself is going to be really important for it.
Absolutely. So we're starting to run a bit low on time. Is there anything else you would want to add on from anything we've discussed in the last 30 or so minutes?
Yeah. I would say kind of just like what I said a little bit ago, but like that idea of like having a plan and going with it. But again, setting yourself up for potential success, and advocating for the profession in a HIPAA high-tech safe way is going to be really important to do. But keep showcasing what you're doing, keep being proud of athletic training on social media, and making those friendships and those connections. I think you know, we have a lot to say for when we're allowed to get back in person and have district and national conventions together of some of the positives that have come out of the COVID-19 pandemic and social media. So thank you so much for having me here today. I really appreciate it.
Thank you so much. We greatly appreciate you taking the time out of your very busy schedule, you know, and sharing your wisdom on this. We greatly appreciate it.
Absolutely.
Great.